Every student and actually every faculty and staff member must sign a social contract with what their responsibilities are before they come to campus. And it talks about mask wearing and hand washing and preserving social distancing and things like that. We'll have student ambassadors to monitor that. One of the things we'll look at is how well do people comply with that. And then the other thing we'll look at is the rate of infections in the community. Those are pretty much the two indicators. If we had to draw down our operations, and right now, based on all the things I just told you about, we'll be able to bring back about 52% of our curriculum we'll be able to offer on campus. So about 70% of our students will have one or more classes on campus. Every one of them that we can, we're also offering remotely. So if students or faculty don't feel comfortable, they don't have to come to campus. And so we put all that in place. If we had to draw that down further, we've got a very detailed plan on how to do that. What are the triggers by which we would make those decisions, and do that in a very phased, incremental manner to allow us to do that safely, and at the same time continue the educational process. All of our classes we put online in March. We're prepared to be able to do that again. We measured the square footage of every one of our classrooms to provide 50 square feet per student, which is well in excess of the minimum required. We're buying everyone cloth masks, set up the rooms to preserve social distancing. We've basically doubled our housekeeping staff, and then we surge them throughout the day depending on when people will be on campus. We've plotted out by days of the week and hours of the day how many people are going to be on campus, and we surge our housekeeping staff to parallel that to keep the things clean. We've put in place what I call the 7 layers of protection. So the first is that everyone before they come to campus every day must take a health assessment, and it's online, it's an app. And they answer a certain number of questions and take their own temperature before they come to campus. And if they clear all that, then they're allowed to come to campus. If not, they're told to go and see their physician and get medically cleared before they can come to campus. Then once they get here, we have given everybody and purchased 3 cloth masks for all of them, so they've got masks to wear, and we've got vending machines and places where they can get masks if they forget them. And then we've bought literally hundreds of hand washing stations that are all over campus, so they keep their hands clean, and a lot of educational materials about not touching your face and preserving social distancing. We are focusing our environmental measures on hand washing in our bathrooms and making sure soap and things like that. We're cleaning several times a day, high touch, high volume areas. As well as we've rearranged the campus so that everything is socially distanced. Meals are going to be grab and go, minimizing the impact for congregating and risk of spread. We are going to be doing testing. We've made a great arrangement with Cleveland Clinic to do testing of people who are symptomatic, people who are living on campus. We'll have about 800 or 900 students living on campus in our residence halls. If they get symptomatic, we will test them right away, or anyone who's an identified close contact. We're going to be doing our own contact tracing in partnership with City Public Health, so that if somebody is identified as a case, we can immediately reach out and identify their close contacts and get them tested. And then for those that need it, we've set aside space in our residence halls for quarantining and isolation. So it's 7 layers of protection that are coming together. Cleveland State was blessed because Ohio is one of the few states where all the public universities and colleges came together to say, how do we do this in a smart way? And we actually led that effort. I was privileged to lead the work group for the state on how we would do this. So the same things that I just shared with you is what's going on at all the public universities and colleges across the state.